Hi, welcome Mr. Amit from Royal Sundram.
Good morning, sir. Amit this side.
Hi.
Thanks everyone for taking time out for from the busy schedule to take this session ahead.
Our pleasure, Amit. We are happy to have you. Do you want to share your screen, Amit?
Yeah. I'll just share my screen and
Yeah, please
the
do that.
PPT which I have.
Yeah,
Yeah,
can you try that now?
just give me. I hope you guys are able to see this PPT.
Yes. We can see that.
Yeah,
Thank you.
yeah. So as I just mentioned earlier, also we are very much delighted to have you all for this session, and looking forward to have a great session.
Yeah.
And
Amit, we'll start in around 4 minutes time.
sure, sir. I'll just wait for your go ahead, and then we'll start.
Yes,
And
please.
Saurav has joined. Saurav.
Yes,
Yes, sir. Yes, sir. I have joined.
Okay, Saurav. Thanks.
Yes, sir.
Amit, for your information, we are not only on Zoom, we are live streaming on YouTube also. So most of our staff are on YouTube.
Okay. So,
And all our branches are connected with Zoom and YouTube, and depends on the connectivity what they want to do.
but it's a nice initiative, right? It's very good of use of technology.
Thank you.
Yeah. I have not see. I have done a lot of trainings, right? But the effective use of technology, as you mentioned, it is on live streaming on YouTube.
Yeah.
So it is new for me.
Thank you.
Yeah. Thanks. It's a very
We have around 200, 250 people attending a session.
okay. Great. Yeah. So good. So far, I've seen 15 participants.
That's on Zoom.
So that's on YouTube and someone on YouTube and other.
Majority will be on YouTube.
Yeah. Good. But it's good. See, motive is to we reach out to as many as people we can,
Yes.
and the post presentation. I'm sure is this a first session for or
No. This is around 13th session. I think.
okay. So I think that the guys are already aware how the Lifeline product is all about.
Yes. We have done a round of vehicle insurance and health insurance. Now we are starting the life insurance.
Okay.
Amitji, it will be, this is Sunil, it will be first session for Royal Sundram actually.
Yeah, Royal
Okay.
Sundram.
Okay, Sunil. Thanks.
Okay.
Thanks for telling me this because I'll set the context in that way only because if it's the first session, then I'll have to highlight everything.
Right. They know the basics of health insurance. Yes,
Okay.
from Royal Sundram's point of view, we have to tell
Sure.
everything what we can.
Sure. So I will also include my the changes we have done in from 15th October 2020 because we have brought in some new changes which I think and I assume that the industry is not able to meet, and very good features we have brought into Lifeline version 2, which is already effective from 15th October 2020, and
Right.
I think that team will take benefit out of these features and probably will convey the same to the customers.
Sure. Dr. Ashley, that Royal Sundram is very challenging on the premium part. Plus, as Amit ji is saying, they have come up with some unique features also. So again, that will be very good product to promote actually, what I believe, what I am
And
getting the feeling.
Yeah.
Yeah, sir. And I just wanted to say, sir, uh, see, now you see the pandemic, how it is going on, right? So every insurance company is seeing a lot of, claims inflow from, the average claim is going up to 5.5 lakhs for this, pandemic. And so it is imperative to have a, some price revision because, the Lifeline was launched in Jan 2015. So it's been almost 6 years, like, we did not touch the pricing part, right? Because we were at comfortable level, our loss ratios was good. We were able to, sustain the product. But since last 2 to 3 years, when the medical inflation has gone up, like, you all read in a newspaper, it was somewhere, single digit some few years back. Now it is into double digit, right? Medical inflation. So every year it is increasing, right? So this is the reason, like, we change the pricing. But the good thing, like, we have this zone 2 ka premium, right? So
Right,
2 is 15% less than the zone 1.
right.
So you will not find much difference with the competitors in zone 2. I agree, like, in zone 1, you will find Royal Sundram premium at par with the competition, and not because we are very much competitive at higher sum insurers are also even after the price revision. I'm just, discussing the background or, the pricing, since Sunilji has, mentioned that the pricing is challenging. But sir, I just wanted to assure you, like, when you will look at the higher sum insurers like 10 lakhs to 15 lakhs, 20 lakhs, right? We are very much competitive at that sum insure, and even after price increase. I'll show you some comparisons also, I have, and I hope that, we all together will do the good numbers. And the most important part is, like, as I just mentioned, like, we have this zone 2 ka pricing. So other insurance companies are also having this pricing model, but the thing is, if the customer is from zone 2 go to zone 1, he will be penalized with co-payment or some sort of, penalty, right? Co-payment or some sort of restriction he has to face. But the good thing is Lifeline, when the customer can buy a product anywhere in the country and go anywhere in the country for the treatment, right? So my zone 2 customer can anytime go to zone 1 for the treatment, and we will not impose any sort of co-payment or any sort of, restriction to that customer. So this is the good thing we have in Lifeline.
Right.
So I'll just wait for your go ahead, sir, and then we can, start.
Yeah, we can go ahead in around 10 seconds. But before that, could you also tell our people what Zone and Zone 2 is when you're going around, when you're going deeper into the subject?
Sir, can you come up again? I didn't get you, sorry.
So you were saying Zone 1, Zone 2, right?
Yes, sir. Yes.
So will we have a list of which are the towns of Zone 1 and Zone 2?
Yeah, sir. Yeah. So as you see, in zone 1, we have the 4 metros.
Oh, okay.
4 metros: Hyderabad, Bangalore, Pune.
Oh,
And
Zone 2.
so Delhi NCR, Mumbai, and the areas near to Mumbai, Thane, Vasi, and all, right?
Okay.
And the Pune, Bangalore, and Hyderabad. So these locations are comes and entire state of Gujarat. Gujarat comes into zone 1 because of the the claim experience every insurance company has in Gujarat, and the rest of India falls into zone 2. So entire MP, entire except Bangalore, entire Karnataka, except Chennai, entire Tamil Nadu, and likewise except Hyderabad, entire Telangana, and the Andhra Pradesh, and Chhattisgarh, and this barring this Meerut, Noida, Ghaziabad, entire UP. You have base across the country. So Rajasthan, entire Rajasthan falls into zone 2, right? So we have a lot of states which are into zone 2, and like I have been given the understanding like you have good presence in south. So
Yes.
in south also, like barring Chennai, entire Tamil Nadu falls into zone 2, and because it's a metro, Chennai.
You can
Likewise,
start.
Maharashtra, yeah.
Everybody come.
Maharashtra also, if you leave it Mumbai and Pune, entire Maharashtra falls into zone 2.
Amitji, you can start now.
Okay, sir. So, good morning, one and all. My name is Amit. As you know, I have already introduced myself, and once again, I just wanted to thanks everyone for joining this session. And the post session, I assume that you will be able to know the things which good about the lifeline, and so I'll not go into this because I think that this is a 40-minute session, sir. Or is it will go up to 1 hour.
40 minutes and then questions.
It's a 40-minute session, no, sir?
Yes, 40 minutes, correct.
So I'll just touch upon the important features, and because I just wanted to highlight this, like the second biggest spend in India is on healthcare expenses after food. The earlier slides which I was showing to you, this is with the context of the earlier slides, right? So healthcare expending is increasing by 10 to 12% every year, which is because of this pandemic. This you will see that this figure will go up. So this figure was in 2016 5 lakhs crore. So when the next figure will come, you will see that a lot of people are spending on healthcare. And in fact, in today's newspaper only there was a comparison, like in the states, like the which states is ahead in buying the health insurance products. So Mumbai is leading the chart, followed by the Delhi, and this Bangalore. Bangalore is one of the city which is wanted to have this health insurance cover. So it is in today's newspaper only, right? And I will not discuss this estimated expenses in hospital, because you guys are already aware, like what it takes to get a treatment for renal failure or stroke, or for that matter angioplasty and all. So we will just come to the important points. I'll just start with the lifeline. Yeah. So guys, you know that the most of the health insurance plans have two the types of plans, like one is the individual health insurance, and another was the family floater health insurance, like wherein you want to cover your family, which comes into the floater category, right? So what is the eligibility for our policy? Like policy offers covers options for the we allow maximum 6 people in the lifeline, husband, wife, and 4 dependent children, right? So the children up to the age of 25 can be considered in the parents policy. So once the children will turn 26, they will automatically move to the next policy, right? So 6 maximum relationships can be allowed, 2 husband, wife, and 4 children, 4 dependent children, right? Policy tenure is 1 year, 2 year, and 3 years, right? So when you buy for a 2 years cover, you will get a 7.5% discount, and if you will buy for a 3 years, then you will get 12% discount. So it's a good and if you add 15% zone 2 ka discount, that comes out to very good proposition for the customer. So we can target the long-term policies also, right? So policy can be purchased on individual basis, or also family floater. So we have various combinations, like one and one child, 1 and 2 child. So this is the combination that to go into detail. We have a calculator. You can easily calculate the premium, and whom you can consider. So who can be insured in this policy? Self, the person who is 18 years age can buy this policy for himself and herself, making his and her as a proposer. Adult dependents. So adult dependents, like again the 18 years. Child dependent, so maximum minimum entry age for the child is 91 days, and the maximum 25 years. So policy offers 100% lifelong renewals, with no covers using that earlier the PSUs are having. So I'll just go to the lifeline variants. Like in lifeline we have 3 variants. So one is elite, second one is the supreme, and the classic. So according to customer requirement and segmentation, what we have done is, like we try to cater everyone, right? So our sum insured is as low as 2 lakhs and goes up to 1.5 crores, right? So so we try to cover all the segments and all the customers, entry level customers, beyond the entry level customers and our HNI customers. So we have products for everyone, right? So you name it, like if you want to give the product for the celebrity and they have a higher some requirement 1.5 CR, then we have a product elite, right? So if you have a lower sum insured requirement like 2 lakhs, 3 lakhs, 4 lakhs, so we have a product called classic, right? So in entire one product, we have 3 variants which cater to everyone. We will go into details, so first, I just discussed the classic plan, which is our entry level plan for the customers who are, first time buyers or just wanted to test, the health insurance. So it is a good plan for them. And the good part is the classic has 2 lakhs, 3 lakhs and 4 lakhs ka sum insured, right? And the good part is across all sum insured, there is no room rent capping, there is no ailment capping, and there is no such restriction in classic also. So my classic customers, my 2 lakhs ka customers can go to the deluxe room also, right? So there is no such restriction on this, right? So in Supreme, we have 5 lakh, 10 lakhs, and 15 lakhs, 20 lakhs, and 50 lakhs ka sum insured, right? So in Supreme, we have, I just mentioned, like, in 15th October, we have brought in 3 new sum insured in Supreme. So after 5 lakhs, we have 7.5 lakhs, and after 20 lakhs, we have 25 lakhs, and 50 lakhs ke baad mein, like, we have a 1 CR ka plan. So in Supreme, we have introduced new 3 sum insureds, and which customers can opt for. And elite, which is my HNI customer plan, right? So it starts with 25 lakhs and goes to 1.5 CR, right? And as so I just wanted to say one most important point also, like, in classic, your sum insured gets increased by 10% every year because of the no claim bonus, and in Supreme and elite it goes by 20%. So in next 5 years in Supreme and elite, your policy will be doubled, right? So your 50 lakh sum insured will become 1 CR. And the good part, what we follow in the lifeline is it is non-reducing basis. Our cumulative bonus is non-reducing basis. So even if customer will make a claim, we will not reduce his cumulative bonus. Whatever that cumulative bonus customer has earned, that will remain with him throughout his life, right? So we do not reduce even if he will make. So this is the most important part I just wanted to highlight, right? So in Lifeline Supreme, basic features, and the Lifeline Supreme, like, it has an inpatient treatment, pre-post hospital 60 and 90, domiciliary hospitalization. We cover all daycare procedures, right? So what is new about Lifeline? Reload of the sum insured, right? So like our reload doesn't work as a like it's a refill, restore, or a reload which is available into market, which which says, like, the customer first has to exhaust entire sum insured, then the cumulative bonus, and then the customer will eligible for the restore or refill or sort of reload, right? So in our case, the if your sum insured is less for your any future claim, so then the customer will be able to get a reload ka benefit, right? So I just wanted to highlight this with the example, like our customer has a 5 lakh cover, and unfortunately he has a 4 lakhs claim in in next 3 months, and so he ideally left with 1 lakh, right? And for second claims, for his second claim, like, unfortunately the claim comes for a 3 lakhs rupees, then we will not ask him to say that first you exhaust your 1 lakhs and then you will eligible for the reload. No, so we will pay entire sum insured, we will pay the entire claim from the reload also. So it doesn't, like, you need to exhaust entire sum insured and cumulative bonus to get the benefit of reload. So this is how no claim bonus I have already discussed, like it is on non-reducing basis. And then we have a emergency domestic evacuation, which is bed to bed transfer in case of emergency, which covers your air ambulance also. And second opinion for critical illness. So earlier we were giving the second opinion for 11 critical illness. Now we had added 11 more. So 22 critical illness ka cover the customer will get second opinion, right? Same plan can be opted as a hospital. You can add as a hospital cash or the top up plan. So that too, no sublimits and no co-payment, right? So across all our plan, there is no sublimits, there is no co-payment, there is no room rent restriction. Pre-post, as I have just informed, 60 and 90 days we follow in Supreme. 30, 60 we have in Classic. Daycare procedures, all daycare procedures are covered in our policy. The policy also covers your Ayush treatment. So if the person gets hospitalized into government hospital for Ayush treatment, he will get up to the sum insured, and the other private hospitals, there is a capping of 30,000 rupees for Ayush treatment, alternative treatment, which is generally called as an alternative treatment. Policy also covers your organ donor expenses. So the whatever, and it is up to the sum insured organ donor. Ambulance cover. So apart from your the ambulance, this bed-to-bed transfer, emergency domestic evacuation, which is have a 1 lakh ka cover in Supreme and 3 lakhs in Elite, also covers your air ambulance. Apart from this, you also have a 5,000 rupees ka ambulance cover. So in ambulance, we have also done some sort of innovation. The customer need not to call for an ambulance. Like if the ambulance is not available handy, then the customer can call upon this Ola and Uber. But the customer can go into hospital by hiring Ola and Uber also. For that, I just wanted to we'll discuss this features later on. I just wanted to first highlight the basic features which we have in Lifeline. The customer will get annual health checkup in Supreme and Elite, and in Classic, customer will get every once in 2 years. So and it's a free of cost, the medical checkup for the entire family. So we will provide 100% reload of the sum insured once in policy year, provided that the everything like the base sum insured and no claim bonus, if any, is insufficient as a result of previous claim in that policy years. So I just mentioned you need to exhaust entire sum insured and the cumulative bonus, you will be eligible for the reload also. Agar aapka sum insured will less. So vaccination in case of animal bite, we also provide up to 5,000 rupees for the vaccination. In case of dog bite, honeybee bite, monkey bite, or any other animal bite, so the customer get a 5,000 rupees vaccination cover. Emergency domestic evacuation, which I just said, is a bed-to-bed transfer facility, which is benefits available up to the sum insured of 1 lakh rupees. So it also covers your air ambulance. Second opinion for 11 critical illness. So we have a tie-up with Europe Assistance, which will facilitate this facility, right? So earlier we were following 11 critical illness. Now we have added 11 more. So 22 critical illness are available for the second opinion, right? Lifeline Classic, again, the everything remains the same except the pre-post hospitalization is 30/60. Ayush treatment, organ donor expenses, ambulance cover up to 3,000 rupees. Reload is available, right? Elite, which is the HNI customer plan, which covers your international treatment also. So in Elite, we have pregnancy benefit available, which is 2.5 lakhs. Newborn baby cover from day one. We also covers vaccination for newborn baby up to 10,000 rupees. And the Elite plan also has a worldwide emergency hospitalization. So this also works as a travel policy. A customer who is going abroad, has some minor ailments or minor issue, right? The fracture and all, sick tooth, or fever and all, the customer can avail this worldwide emergency hospitalization benefit and international treatment for specified illness. So we have 11 critical illness for those ailments. The customer has options to go abroad for the treatment. So initially we have excluded this USA and Canada from the cover, but the customer wants to have a cover for the USA and Canada, then we can pay a additional premium of 8% and then can include US and Canada for the treatment also, right? So it also covers your this international treatment Elite plan, and the plan also covers your OPD treatment up to 10,000 rupees per person, right? Optional benefits available as a hospital cash and the top-up plan. Maternity benefits are just limited to 2 deliveries, waiting period at 36 months, newborn baby is covered from day one, vaccination. So up to 2.5 lakhs, the customer will get a pregnancy benefit, and the newborn baby is also covered from day one. Vaccination 10,000 rupees, I have already mentioned, right? Worldwide emergency hospitalization excluding US and Canada, customer has option to include US and Canada also, in case he wants to go to in both countries for the treatment. So I just wanted to highlight this point. It is the worldwide emergency is covered up to 20 lakhs rupees, 50% of the sum insured, or up maximum up to 20 lakhs rupees, right? So earlier for 11 specified critical illness, we were having this what is called the earlier the capping was 50% of the sum insured for first year, right? So that capping we have removed from the cover, right? So if the customer is is available for is eligible for the 100% of the sum insured from first year onwards also, right? OPD treatment. OPD treatment, like 10,000 rupees per person. It covers your doctor consultation, medicines, diagnostic test, dental OPD and all, and spectacles, contact lenses, hearing aids. So that is covered once in 2 years up to 30% of OPD limit. But this 10,000 benefits are available per person. So if there are 4 members in the family, the per person will get a 10,000 rupees ka benefit each. Right? Pre-post hospitalization is 60 and 180 days in elite plan, which is one of the good proposition for the HNI customers, right? So ambulance cover is 10,000 rupees per hospitalization per person. Ayush treatment is up to 50,000 rupees in private hospital, and in government hospital the customer will get up to entire sum insured. Hospital cash. So you can also add the hospital cash, which is comes with the additional pricing. So in classing, the customer will get 1,000 rupees per day as a hospital cash benefit up to maximum of 30 days. Supreme 2,000 rupees, elite 5,000 rupees, right? Cumulative bonus I just mentioned, like in this claim free year, every claim free year, and 10% in classic, 20% in elite and supreme. And in event of claim, CV will not get reduced next year, like and you will get a 80% discount and all. So almost you will have this free look-in period. Portability is also available, right? Waiting periods. So first 30 days waiting period is available for across all plans, right? Every insurance company has this waiting period except accidental injuries cases. There is 24 months waiting period for disease like cataract surgery, for hernia surgery, for hydrocele, etc. So pre-existing disease is covered after 4 years in classic, 3 years in supreme, and 2 years after 2 years in elite plan. So elite plan carries one of the lowest pre-existing waiting period, 2 years. These 17 ailments which has waiting period of 24 months in supreme across all plans, classic, supreme and elite, right? Like underwriting. So primary underwriting information which is important for you, and I just wanted to highlight this. So earlier it is a old underwriting the slide which we have. Now we have earlier we were following 46 years onwards, like the 5 lakh sum insured and 45 years of age are free from this medical underwriting. So now we have extended this to 10 lakhs rupees on 50 years of age. So any customer who doesn't have any health condition and age is 51 years, wanted to take a sum insured of 10 lakhs, will not undergo the medicals, right? So 10 lakhs ka sum insured up to 50 years of age is free from medical underwriting. So it would be a STP policy, straight through process, right? It will not go into medical underwriting bucket. So the sum insured from 15 lakhs onwards, any age after 19 years will go into the medical underwriting. So this is the important, right? The 50 years of age, 10 lakh sum insured is free from medical underwriting. But still, like there are some parameters which we need to follow, like body mass index. If the customer is obese and his body mass index is 33 and more, then the case can go into the medical underwriting. If response to 6 medical questions is yes in proposal form, then case will go into medical underwriting. All portability cases are subjected to medical underwriting, right? So that grid is available applicable only for the fresh business. So if you do a fresh business and the customer is 50 years of age, I'm just repeating this again and again because I just wanted to make sure that you are aware of underwriting guidelines which we have changed. So 50 years of age, 10 lakhs of the sum insured is free from medical underwriting if there is no health condition. Again, like claim details, we have 3 TPAs, which is Paramount, Raksha, and the Medi Assist. And for this international treatment and critical illness cover, like so we have a tie-up with Europe Assistance for this. So almost I have covered the basic features, and now I will just wanted to show you. Just hold on, I'll just. Just give me a minute, sir.
What happened, Amit?
Oh, I just wanted to share the this new PPT, na.
Okay.
Just wait. So I hope you guys are able to see this again. What's more, huh?
Yes, we can see that. Thank you.
So upgrade available, like, because as I was, given the impression, like, so I just wanted to cover the basic features of Lifeline. Now, what we have brought into, new features into Lifeline from 15th October 2020. So this is the upgrade available, right? So product construct, like, I have already discussed, we have introduced 3 new sum insured, 7.5 lakhs, 25 lakhs and 100 lakhs, right, into Supreme. So as a new optional covers, we have, like, now you have a top up plan and the hospital cash. And in addition to this, the third customer level options available is the Supreme Plus and Elite Plus. So a moment the customer will opt for a Supreme Plus and Elite Plus, what new thing he will get, like, and as I mentioned, like, we have got very good
Amit,
features.
Amit, sorry, I'm disturbing you. The voice is cracking. Amit, your voice is cracking a bit.
Cracking. Am I audible now? Is this good?
Yes, fine. Thank you. Proceed.
So sir, I just, wanted to
Everybody
highlight, if the customer
hear clearly?
Yes,
I think it's cracking a bit.
then it could be a net, I believe.
In between it's breaking, but yes, we can understand. Please
It's
proceed.
a network issue, like, Zoom has a lot of load.
Right.
But if if you're not able to hear any important point, just please, make me stop, and then, I'll explain this again. So shall I discuss this important point?
Please. Yeah, carry on.
So so the customer will opt for a Supreme Plus and Elite Plus. It's a, additional benefit. It's a sort of rider, like, the customer has to pay 7 to 8% of additional premium, but the customer will get all of new features into Lifeline, right? So the first features is a refresh of the SI benefits. So as I mentioned earlier, the reload is not applicable for the same person, same ailment, but the customer who opts for a Supreme Plus will get a refresh of the sum insured. Like, so this will work for a same person, same ailment also, right? So up to sum insured, the customer will be able to get the treatment for the same ailment. So if a customer who has a 10 lakhs ka sum insured, unfortunately exhausts entire sum insured in a particular ailment, and and he requires the again hospitalization for the same ailment, then the customer will be able to utilize up to the sum insured from this refresh of the SI benefits, right? So the refresh is available for the same person, same ailment also. That will replenish the sort of thing the customer will get again, right? The second benefit, the customer will get a PED coverage in case of life-threatening situation, right? So this is the one of the unique features which we have brought into Lifeline version 2, and the customer will get a pre-existing disease after 30 days, PED cover after 30 days, right? So if a customer who has already disclosed his PED at the time of taking policy, and because of that particular ailment, if he gets hospitalized, or the situation is, the life threatening, the customer will get up to 1 lakhs ka cover in Supreme and 3 lakhs ka cover in Elite Plus, right? So this is sort of a PD coverage available for the customers after 30 days, which is one of the unique features which we have. Abhi industry ke andar, like, I don't think so like any insurance company is offering PD cover after 30 days, right? Additional facility of app-based caps, as I mentioned earlier, the customer who will opt for a Supreme Plus and Elite Plus will have a flexibility to call upon a app-based cap. They need not to wait for the ambulance facility. They can call upon the Ola and Uber, and then can go to hospital for the treatment. So the facility will be available up to the ambulance cover, like 5,000 rupees in Supreme and 10,000 rupees in Elite plan. Mobility devices. So this is post accident, there are a lot of things which customer need to buy, like walker, wheelchair, or sticks and all, and other equipments which the customer need to buy to get the normalcy in his life. So the most of these insurance company consider these equipments as a non-medical expenses or consumable items, and generally these expenses are not payable. So the customer who will opt for a Supreme Plus and Elite Plus will get a 5% of the sum insured, maximum up to 50,000 to buy such equipments, right? Post accident. So the customer, post accident want to buy a wheelchair for recovery, right? Though he'll be able to get it by opting this Supreme Plus ka benefit, right? And then we also have this second, as I already mentioned, like 11 critical specified ailments has been added into this second opinion ke liye, right? And we also cover the bariatric surgery in this. So obviously this have a waiting period, but bariatric cover is also available for Supreme Plus customer and Elite Plus customers. IVF treatment, which is nothing but the infertility treatment. So we also cover this infertility treatment for in Elite Plus, right? Also, the customer has a EMI options available to for renewals in the new business. So monthly, quarterly, half yearly, and yearly EMI can be availed by the customer. And it is a new benefit which we have brought into Lifeline EMI facility. So this is again like refresh ensures enough sum insured is available to handle any type of emergency by the automatically replenishing 100% of the base sum insured. So it will be triggered for the same ailment. So as I the lot of the reload and restore and refresh is not available for the same ailment. Our refresh will work for the same ailment also. But the thing is, this will be a once in lifetime facility, right? So the customer who has already availed this benefit once will not be able to avail this benefit rest of his life, right? So if he has already utilized this benefit, right? Likewise, the PD cover is also available for once in lifetime. So in Supreme, the customer will get 1 lakh ka cover, and in Elite plan, the customer will get 2 lakhs for the PED coverage after 30 days. But the most important part is the customer has to declare PED at the time of taking policy. So that because of that PED, if he gets hospitalized and the situation is life-threatening, the customer will get this benefit. New optional benefits like in Supreme, the customer will get 50,000 rupees for bariatric surgery, and Elite 2 lakhs ka cover. It has a 6 years waiting period. Mobility devices, I already discussed, 5% of the sum insured and 50,000 maximum customer can get, for to buy walkers, manual wheelchair, crunches, splints, external prosthetics, slings, plasters, and etc. Right? Or if they want to buy a stick and all, right? App-based facility, which is available on up to the ambulance cover, second opinion. IVF treatment is a cover up to 2.5 lakhs per policy period, maximum of 3 fresh cycles. Waiting period of 48 months. However, it has a waiting period of 4 years. So 3 additional CI available for the international treatment. So earlier we were following 11 critical illness for the customer has an option to go abroad for the 11 critical illness. Now we have added 3 more into this category, right? So end stage liver failure, end stage lung failure, and third degree burns has been added into this. Earlier, the first year sublimit of 50% is deleted now. So, however, all claims will be subjected to 20% co-payment. So, the customer from first year onwards will get a 100% cover for his sum insured to get the treatment abroad, but it has a 20% co-payment, right? Newly added features to all plan that the customer will have an option of go for a EMI. Customer can opt for a monthly EMI, quarterly EMI, and half yearly EMI, right? So if the customer will opt for a monthly EMI, he has to pay 5% premium loading, for quarterly 4%, and half yearly 3% premium loading will be applicable. Health and wellness. So in order to keep the customer health good, we have doing sort of disease management for our customers who have suffering from any critical illness. So we have a medical team which calls to customers and we suggest them to take the treatment, or how they can follow the balanced diet, or do the medication and yoga to keep them fit. And in addition to this, the customer will get annual health checkup in Supreme and Elite. There is a health mailer which goes to customer every day, every morning, right? And apart from this, the customer has options to get the discount from Metropolis, Batra and Apollo Pharmacy, and a lot of other diagnostic centers which we have, which we have done the tie-up with them to offer the customers the best services. So it's a part of health and wellness. What has changed, like, earlier I was showing you the revised underwriting guidelines. So for, earlier we were following 45 years up to the 5 lakhs ka cover. Now it has been removed, and the revised underwriting guidelines for up to 50 years and 10 lakhs ka sum insured is free from medical underwriting. So guys, I have almost covered the important points. Now we can have a this Q&A session, because I believe that we do not have much time. So I leave it for the Q&A session.
Amitji, do you have a slide showing that comparison between both your plans? No.
So premium comparison, sir.
No, benefits. Premium and benefits between both the plans.
No, I have so plan. I have premium comparisons,
Hi everybody. Hi everybody. Sujit this side. What exactly we are wanting? Premium comparison in terms of either insurance or what?
Premium cost and benefits. If you have, suppose worldwide cover is not available in one particular plan.
Okay.
Okay. I believe Amit, you would have a premium just calculation with the age wise and with different benefits. I saw that one of that mail. Or in case if we do not have presently, we can just send a mail on it. Amit?
I'll do one thing. I'll share a mail.
Okay.
Sujit.
Okay. Yeah, Amit.
I will share. I'll share comparison.
ठीक है, that will completely be.
I'll share the comparison with you. Send it to sir.
I request everybody else either mute or whoever is speaking can just unmute it.
Yeah. So will you be sharing with us later?
Yeah. I'll be sharing with
yes, sir.
For the entire team over the mail.
Or you can log on to your website and then you can show how an actual entry takes place, and if the premium changes, what changes, all that. If that is possible.
Changes. See, premium calculation is already there in. Once you go in the Play Store and download our premium calculator, you will be able to see the premium calculation on. But I am not sure what exactly benefits we are talking about, because the benefits, if you see, is a host of features that we are talking about. The
Correct.
features are available, and premium calculation can be done through that calculator which is available in the Play Store.
Okay, fine. Is there a maximum age till when you can take?
Sujitji, earlier Saurav has shared some Excel calculator as well, wherein benefits were also written and the premium calculation was there.
Okay, I'll just refer that calculation Excel that you're talking about. Saurav, I hope you're there on the line.
Yes, sir.
Send me that
I'm there.
mail which you shared with them. Let me just assess that and I'll check on it. Okay, you share it with me and Amit both, right?
Right. Okay, sir. Okay.
Well, I have some questions for need clarification. Earlier, we had discussed that there will be no reduction in the no claim bonus. So I'll just want to understand with an example. Let's suppose there is a 10 lakh policy, and in the next 5 years, it will become, the coverage will become 20 lakhs, right? If there are any claims 6th year onwards, so the person is eligible for take 20 lakhs claim for every claim?
Yes, sir. This is the great features which we have to define. So if the policy gets doubled in 5 years, customer eligibility is up to 20 lakhs every. So the cost, we will not do sir, you have already utilized your cumulative bonus in previous claim, so we will not pass on this benefit. No. So whatever the customer has earned, he will get the entire sum insured for any particular element.
So for any subsequent years, the coverage will be available for 20 lakhs, right?
Yes, sir.
Okay,
yes, sir.
Great. And that animal bite kind of thing, it is available in all the variants?
Yeah, no, it is in Supreme and Elite, sir.
Okay, fine. And some belief is there in the market that if claim settlement are through third-party administrators,
Yes.
then there may be a chances of getting the claim denied or rejected. Whereas if the claim is being settled through themselves or the insurer themselves, then there will be a smoother process. Is this correct, or what? I want to know your view on this.
Yeah, sir. I just wanted to. I'll just share my views also on this. It used to happen, sir. The earlier, you are right. Earlier it was the TPA was, were given all the flexibility to take the decision on claim settlement. Because earlier, in fact, the claim settlement also was done the TPA only, right? So they raise the float and ask the money from the insurance company and then pays to the customer. So this used to happen, in the previous. But few years back, in 2016, 4 years back, the regulator has come up with a standard guidelines for the health insurance, wherein they discuss this with the insurer, and then I would request, please mute yourself, because it creates background disturbance. So it used to happen, sir. Now the every rejection, the TPA has to refer to the insurance company, and in fact the claim settlement is also done by the insurance company only. Your assumption, like the processing is smooth. So we have maintained this also, like up to 2 lakhs the TPA doesn't require any sort of approval from insurance company. So up to 2 lakh the TPA can take decision on behalf of insurance company and can pass the claim, right? Every rejection need to be referred to insurance company. So if the TPA thinks, like this particular claim is not payable, or there would be a rejection, then they immediately have to refer this rejection to the insurance company, and the medical panel will take a call on the rejection. So it is not like the TPA will take a call and then will reject the claim. They have to take the second opinion from the insurance company.
Okay, what I understood is that if a claim is beyond 2 lakhs, directly or indirectly, the claim is being settled by insurance company only.
No, it gets referred to insurance. So up to 2 lakhs, any claim amount up to 2 lakhs, TPA need not to refer the claim to the insurance company. But if it is beyond 2 lakhs, then they need to refer to the insurance company, and there is a medical panel available in a head office, and they immediately see the merits of the case, and then so up to 2 lakhs, and then most of the claims fall into this category, sir. So average claim amount is is 70,000. So most of the cases goes doesn't require to refer to the insurance company.
And most of the companies, they actually give in writing that we'll be settling the claim or approval in next 2 hours or 30 minutes, or whether they follow it or not, that is a altogether different story. But I just want to know whether we give some assurance to our customers that yes, if any approval or claim is raised, we'll be settling in a certain amount of time, so that we do not get queries in between. Let's suppose the TAT is 4 hours. So after 2 hours, customer used to call us, where is my approval? I'm waiting. I have been discharged. I'm waiting for 2-3 hours. So is there any turnaround time which we can mention that by this time you'll be getting approval or something?
Yes, sir. So the turnaround time is 2 hours, sir. Right? We do not have any something written on this, and but see, we have sent a MOU with our the third party administrator like Paramount, Raksha, and Mediasis. So we have mentioned our intention. So we have already told them, like the every cashless case need to be responded in. So it could be a query, it could be approval, it could be a rejection, but you have to respond to the hospital within 2 hours. So this is the trend we are following. Sometimes what it happens is, when in big hospitals, when the customer approaches a TPA desk, right, and they have a lot of other the customers also. So generally, what I come across, because I have also part of claims team and I've seen this earlier also. So they have a lot of other, pre-authorization request. We need to be sent it to insurance company, and then they say, no, sir, we have sent it your request, 2 hours back, but we have not received any reply. So to avoid this issue, what we have done is, the customer need to mention his this mobile number, and it's already it's been captured in our database. And if it is good, like if they mention it on a form, pre-authorization form, the customer instantly get a SMS, right? The claim has been received in Royal Sundram or the particular TPA, and they say the process. So at each moment, the customer will get an update. Your claim has been submitted for us, and if there is any query raised, then the customer will get a query has been raised, or if it is approval, then the customer will get that 50,000 or something approved towards your claim. So that sort of SMS the customer will get. So we ensure like the customer will get update within 2 hours of his submitting his cashless request. So 2 hours that we are following, sir.
Right. I have come across some very good unique features which I don't find anywhere in this industry. So I think Royal Sundram has given some good points which are very hard to beat, I believe.
Yeah,
Dr.
sir. We thank you for your feedback, sir. And called refresh, right? So refresh, it is available for the same person, same element, and it is a very good feature.
Right.
Actually into trouble, like any catastrophic year, he wants to get a cover, he'll get PED cover after 30 days, right? So in such scenario, PED, it's always be a debating issue. It's always has a debate, right? You most of the insurance company will not pay within 2 months or 3 months, right? While taking a policy, if the customer who has mentioned that is a customer and he's taking a BP medicines, unfortunately gets a heart attack. So I'm damn sure the insurance company will not
Yes.
that, so in our case, at least he will get a 1 lakh cover in Supreme and 2 lakhs in Elite Plus without raising any question and doubt.
Right. Because they will somehow relate that incident to yes.
Yeah. And app-based facility, like the customer can call Ola, Uber.
Yes.
I believe in metros, the Ola, Uber will come earlier than the ambulance because
Agreed.
it's nearby your house only.
Right. Agreed.
And mobility devices to buy a wheelchair, walker, 50,000 rupees ka cover, right? It is also a very good facility. So the features which we have,
What is the claim settlement ratio? Current one?
See, current one, sir, I have not received, but the earlier we had some 90% claim settlement ratio, and we ensure that each and every genuine claim needs to be paid, right? So our philosophy is to we do not penalize customers, or we ensure that the customer should get a claim, because and this after moratorium, like after 8 years, the insurance company cannot deny the claim. It is also a good cover for the customers. Like after 8 years, insurance company can't say that you had a disease or you had a
right.
That year, so that will also help. And then the Royal Sundram approach is always like we should honor each and every genuine claim.
Dr. Ashley, if you have to ask something.
I don't have anything to ask Sunil, but can you just summarize for all of us what are the unique features
So can you bit loud? I am not able to hear you.
Sunil, can you summarize for us what you felt are the good features of Royal Sundram?
Well, they do have some unique features which is not available otherwise. Like Amitji has already mentioned, that the reload sum assured is available for same person, same illness as well. It is available with only 1 or 2 insurance in the industry, I believe. Then there are coverage
after waiting period. Sunilji, like as you mentioned, it is available for 1 and 2 insurance company. That too after waiting period of 55 days. So the customer who has already got hospitalized for a particular ailment will not be able to get the claim for the same ailment next 45 years, 45
Right,
days. But in our
right,
case,
right. Yes, very unique feature indeed.
yes.
And
Thank you, sir.
there has been cases of animal bites also, but we are somehow ignoring this feature. So we can proudly present this feature as well to our customers. And the beauty is that there is no reduction of no claim bonus. So once some initial claim-free years pass by, we are always on the higher sum assured by paying the premium of lower sum assured. So that is again an advantage what I can see here.
Correct.
And once we'll be going through the details of the product, I do find that this is the right product to pitch even to our high-end customers, as well as we have options. And again, the one beauty is that in the lowest sum assured category, they do not have any kind of cappings. Otherwise, I believe every other insurance company is having some of the other cappings with lower sum assured categories. So again, the customer base we can touch here is again from lower to very higher. So everyone is having something here in any of the plans. So that is what I believe here.
Good. Thank you, Sunil.
Thank you so much, Sunilji, for your encouraging feedback. And we look forward to have a very good association with your company and with your employees.
Sure. We'll be taking up and by the end of this month, we'll be reaching out to our customers. So yes, we are expecting some good business here. Plus, we'll be providing health insurance to our customers, those who are not covered. So again, this seems to be very encouraging kind of thing. Right.
So the current slide, I just wanted to show you one premium comparison of Supreme Plus. Supreme 25 lakhs ka cover, individual and 2 adult, 2 child. So people for a 30 years old guy, he will get a 25 lakhs sum insured in 10,833 rupees from Royal Sundram. In Birla premium is 20,000 rupees. 11,000 rupees, max 13,000, 17,000, which is SDFC Health now, and Bajaj Allianz 19,000 rupees. In fact, a 40 years old guy wants to buy a 25 lakhs cover is 16,000 rupees, sir. 16,000. Right, and this is zone 1 pricing, sir. Zone 1 like Delhi NCR. So if you go for a zone 2, you will get this in less than 15. You will get a 15% discount on this premium also.
Right.
So we are very much.
Sunilji, this is Sujit. I just wanted to request, can we have a little refresher session? See, now that we had a training, most of your POS and other channel partners would understand that what are the benefits and what are the uniqueness of it. But when they actually go into the market, they will face certain queries, which is client specific queries. So probably if we can have a little refresher training, say probably by second week of December, everybody would have one or two kind of a query which we can resolve, and that session we can only have a little bit of query and experience session, so that little more in-depth or insight comes to the product.
Yeah,
Can that be possible?
Very much agreed, Sujit ji. In fact, Dr. Ashley has already planned this thing in the coming days. So we are already in discussion. So yes, what you have suggested, we'll definitely be having a refresher session. Dr. Ashley.
Very good suggestion. Yeah. So thank you, Mr. Amit and Saurabh from Royal
Thank you,
Sundram.
sir.
I think you've got a beautiful product, and we can't wait to promote it. Thank you very much. Thank you, Sunil, for your time. Wish you all a brilliant week ahead. Good luck.
Thanks, sir. Thank you so much. Thank you so much for
Thank
your
you.
encouragement, and we look forward to hear from all of you as to how the product is featuring in the market through your channel.
Absolutely.
Right,
We'll
sir?
meet in December mid for a review
Right,
and
sir.
answer session.
And Saurav, please send all the updated materials to me so that
Right, sir. Right, sir.
I'll have to share all the details with Dr. Ashley. He
Yes,
has
sir.
to get it converted to local language, and then they have to float to their employees and associates.
Right, sir. Right. I will share you the updated Excel sheet. That in your mail ID, sir.
Right.
Right.
Acha, Saurav, have you shared the
Yeah.
microsite that we have created for them?
No, sir. Not yet, but I will.
Fair enough, sir. We have
Yeah.
also the microsite ready so that you can share it to your POS, who can have a very easy access towards booking these products and all. Right, sir?
Thank you. Thank you so much, guys.
Right.
Thank you, sir.
Thank you.
Thank you, Sujit ji, Amit ji, Saurav. Thank you so much for your time.
Thank you, sir.
Thank you so much.
Thanks the entire team.
ഇന്നത്തെ സെഷൻ ഇവിടെ തീരുകയാണ്. ഇനി നമ്മൾ മലയാളത്തിൽ ഇത് ചെയ്യാം. ഞാൻ ഇവരോട് ഡോക്യുമെന്റ്സ് എല്ലാം ചോദിച്ചിട്ടുണ്ട്. മലയാളത്തിലാക്കിയിട്ട് നമ്മൾ ഡിസംബർ 1 കൂടി മലയാളത്തിൽ സ്റ്റാർട്ട് ചെയ്യാം. ഗുഡ് വീക്ക് എവരിബഡി.